everyone taking time to kind of preview some of the what we deem as best-in-class platforms for individuals, small and large markets. Just so everyone is aware, if you can put your phone on mute if you're currently not talking, this is going to be recorded for everybody that wasn't able to join today, so we'll be able to send this out to all of the members. Just an FYI. We also have Jason Suspaniak on the call. A lot of you are familiar with him. He's going to wrap up the call and might chime in here and there to answer some questions just moving forward. So the goal today is really to showcase our vendor partners at a very high level, right? So they're only getting 20 to 25 minutes to demonstrate their capabilities. And so that's a very short amount of time for them. So it's very high level, and we can get more into the granular details within your local offices. So whatever platform is relevant to you, your market, your agency, we'll be able to bring that to your local office where we can get really deep into the details of that. We can do that with lunch and learns, breakfast meetings, but just to be aware that these are our Aflac's vendor partners. We have very strong relationships with them, and they're only getting 20 to 25 minutes with really a 5-minute Q&A at the end, because at every half hour we're going to be switching vendors. So the agenda today is, first we're going to hear from our internal platform, which is Everwell. Matt Cook is a senior trainer implementation consultant, and Mandy Rico is the market trainer in Wisconsin, so they're going to be demonstrating Everwell for us. From 1:30 to 2, we're going to have Employee Navigator. From 2 to 2:30, we'll have B-Swift. And from 2:30 to 3, we'll have Maestro. So just kind of be aware of the schedule. If there are questions that you guys have that you don't get to ask during that half hour, make sure that you send either myself or Jason an email with the vendor name and the specific question that you have. We want to make sure that we follow up and address any questions that you have moving forward. So I'm actually going to introduce Matt Cook, who is going to demonstrate Everwell. We do have a few of our Everwell gurus out of the office this week, so there might be a few questions that we can't answer today, but we'll be able to address them in that follow-up email. And so, Matt, are you on the line?
I am here.
Okay. I'm giving you access. You should be able to share your screen.
Okay. Let me know when you guys can see it.
I can see it.
Okay. You want me to go ahead and get started then?
Excellent. Thank you. Yes.
Okay. Welcome, everyone. Thanks for having me on the call. I want to introduce you guys to Everwell, which is the web platform Aflac has introduced in the last couple of years. I'm just going to go back a little bit and tell you a little bit of the history and then show you what the system is built for. We rolled this out probably a little over 2 years ago. And in the beginning, it was built mainly just to enroll Aflac products. We needed a web-based enrollment platform, and we were currently using standalone systems housed on individual laptops, which was very 1990s of us. So it was around 2014, 2015, we decided to act like it was in the 2000s. So we went web-based, but we built the platform designed to partner with others. So we knew long-term what we wanted this platform to do was to work with other carriers to be able to provide partner products as well as value adds above and beyond just the Aflac programs. So there are people out there who use Everwell specifically just to enroll Aflac products, and there are people who position it as a real employer solution. There is no restriction on what account can have Everwell. However, it does fit best with a certain demographic of groups, which I'll talk about in a little bit. So I've put a test case in the system just to show you guys. And what I haven't done yet is I haven't set this group up on a plan year. And the reason why is I wanted to show you guys what within the group is available at this time, but also know that we are on a daily basis partnering with other vendors to be able to have access on the platform. What really makes it different is that on the platform itself, the requirements for participation are much lower. So for example, Delta Dental is available through Everwell. Well, Aflac's product requirements in any case is that there has to be at least 3 employees, 1099 or W-2, to offer Aflac products. And we've gotten these carriers to agree to those terms. So if it's a 3-man company that wants Delta Dental in place, they can offer it through Everwell and give them that true group rate, even though it's a 3-man company. And that goes with a lot of the vendors that we're partnering with. When you set a group up within Everwell, you have the ability to only select Aflac products, which kind of changes the parameters of the system. Everybody has different rules when it comes to submission of applications, to underwriting, and all of those things. So basically, if I say it's Aflac only products, the system itself understands that we're not partnering with any vendors at this time. Cafeteria plan just says that we're pre-taxing the programs that are available on this platform. So if I select cafeteria plan, it's basically just stating that the programs have the ability to be pre-taxed. So if I set this group up for a 4-1, the next thing it's going to require is a census. And with a census, we have the ability to get quotes on things above and beyond Aflac. Aflac in and of itself, we do not require a census or employee data to quote because our rates are the same regardless. However, with other carriers, health insurance specifically, if they need more employee data, the system has the ability to upload an employee census ahead of time. If there is no employee census and we're putting Aflac in place, what happens is as we enroll employees, it actually builds a census within itself. So if next year we go in and want to add a partner carrier to it, we have the ability to download the census from the system and have that be much easier going forward to have access to. If I don't have a census, I can put the employees in manually, which obviously can be cumbersome. So that's where having that employee census is really important as well too. Moving on, what will happen next after the census is put in is you'll see what programs are available to this particular company. Now I'm quoting Indiana because that's where I'm at right now, but we have the ability in each market to have things specific to that market based on what's available. So you'll see here that we have the typical Aflac products, the accident, CI, hospital, the list goes on and on. Currently right now we've also partnered with a medical insurance company, so we're able to offer health insurance through the platform. We've partnered with VSP, so we have group vision available on the platform. We have through group life and long-term disability, we've partnered with Reliant Standard to be able to offer those programs as well. We've partnered with Easy Shield, which is kind of like a LifeLock, where you're able to do fraud protection for your employees. We've partnered with a company called MeMD to do telemedicine. Aflac is also in the next 90 days rolling out what we're calling our value add suite, where we're going even further into the non-ancillary benefit route and partnering with other companies to be able to offer employee wellness programs, more telemedicine style programs. The list goes on. We really built the platform designed for other carriers to say, hey, we know that you're out there in front of employees. Wouldn't it be great to be able to offer these as well too? A lot of the programs come at no cost. Some of the programs are employer sponsored. Some of the programs are employee sponsored. It really just depends on what you want to offer and what you want to show. We've also, what's kind of unique, we've partnered with Go Health, and what that does is if we have a company that wants to get rid of health insurance, we can go on the exchange and use Go Health to quote the employees on what programs would be available to them and what subsidies they'd be qualified for. Through Go Health, you have 2 options. You can yourself enroll them on the exchange. So if I'm an exchange certified enroller, I can go ahead right there with the employees and enroll them in an exchange program. If I'm not certified or I don't want to take that time, I can do a referral to an exchange certified agent. So I can basically quote the employee on what program is best for them, and then it sends a referral out for someone to reach out to them. So when we built Everwell and when Everwell was first rolled out, it really was designed knowing, and I'm going to use Indiana statistics. You guys know Wisconsin better than I do. In Indiana right now, if you have less than 50 employees, about 60 to 65% of those businesses aren't offering health insurance. So what this platform does is it gives that employer the ability to do things for their employees when health insurance isn't their competitive advantage. Right now in our marketplace, one of the biggest challenges we're coming across is employers are competing solely based on wage. It's whoever pays the most, because they don't have benefits in place or value adds in place, and they don't know how to get them because they got rid of health insurance 5-10 years ago. So this kind of brings back the ability for the employer to offer things for their employees and to be able in an interview to say to new candidates, yes, we do offer a comprehensive suite of benefits. And really going down to 3 lives makes this a product that a lot of competitors, aren't in that area right now. They're competing in the over 50 market. So we're trying to really hone in on that under 50. Obviously, this system will work with any size group, but the bigger the group, the more they probably already have in place. I'm going to show you the next part of this that employers are really taking advantage of in that smaller market. So if I actually go into this group itself and I go to the employees, with this system, we have the ability to manage the employees themselves. So as employees register and as we upload the census, we now have all of this employee information captured within the system. So the employer has access. This is all safe. It's not accessible by the employees. They don't see anything on this side of the equation. So as an employer, I have the ability to track personal information. So name, birth date, social security number, the job information, so the department they're in, how often they're paid, when they were hired, even as far as down to departments and class, if that's something that you've separated. Salary information, home and work information. So if they have multiple locations for work, you can see which location that particular person works at. As far as the other employee data, I can keep record of dependents. So spouses, kids, those birth dates, and all of those things. It won't satisfy a hard dependent audit, but it does kind of work like a soft dependent audit. So if you're an employer that does want an accurate track of how many spouses and kids there are in the system, they're all in here. If they have enrolled in programs like life insurance or AD&D, it'll list the beneficiaries here. So if I signed up for a life insurance plan, it'll also list my beneficiaries and what the split is on that program. Qualifying events allows me to track the employee in terms of what's happening with the employee. So marriage, birth, death, divorce, terminations, new hires. And what's really unique about that is you also have the ability to upload documents. So if an employee gets married and other carriers require a copy of the marriage certificate, the employer can scan that in, upload it to this employee's page, and really just hand it right back to the employee. That goes as far as comments and documents as well too. If I come down here to comments and documents, I have the ability just to make comments or upload files. And a lot of employers are using that for things like t-shirt sizes or gluten allergies or special needs and those types of things, or they're uploading documents like the resume or quarterly performance reviews. And what it's doing is it's allowing businesses that don't have a full bin admin system to work and function like one. So a lot of the smaller markets, the employers are paying for QuickBooks and they're using PayPal Square to accept credit card transactions. So they're trying to invest in their business any way possible. And what this does is it gives them a way to manage their business like they never have before. So they're no longer keeping 6-foot-tall file cabinets full of personal employee data that is now susceptible to theft or fire or damage. Instead, they're moving everything online, and now from their phone, if they're out of town, they don't have to call into the office and have somebody run to their file cabinet and grab a performance review. They can access it right there at their fingertips. So it is an enrollment platform, but it's so much more than that. We're every day looking at adding to this. Right now, the 2 big things that they're trying to elevate within Everwell, they're trying to give it some type of basic payroll functionality so that an employer could take it to the next level and even do payroll through the system. And they're also really working hard on the direct-to-consumer market as well with this. So right now, this is designed for employers to offer to the employees, but they're really looking at what they can do for individuals that either don't work for an employer, or there's not enough employees to satisfy the requirement, or the employer just doesn't want to offer this system. They're really working on their direct-to-consumer campaign. Aflac has not been strong in the last couple of years with our direct products, but they're revamping those to really come out with a suite for those consumers. As far as the value adds, this question actually came up earlier today, offering some of those value adds like Easy Shield and telemedicine. I honestly don't know if that's something that is in the pipeline, but it's definitely where I see us headed, because that's really what people are asking for, and it's what the market's demanding. So I know I'm supposed to take 25 minutes, but I took 16. I hope that's not a problem. But I also know I've given a very, very high level overview of the system. There's a lot that the system is designed to do that it's not doing yet. And there's a lot that the system's not doing but has the capability to add to it. So on a daily basis, our field is offering up suggestions, coming up with ideas, really wanting to take it beyond just a way to enroll Aflac products. And we're really trying to keep the employer in mind when we do it, so that employers that are looking for help for their business, we want to be able to showcase that as well too, and to be able to solve those problems. So I don't know if Mandy or Jason has anything to add to that before we turn it over to questions, or if I was muted the whole time and nobody heard anything.
Matt, this is Mandy. I don't have anything additional to add. I think that those are definitely the capabilities that the platform offers, and I love hearing the new things that are coming out to help for direct sales and direct consumers. So thank you.
Yeah.
I have nothing to add. I would just open it up to questions to the folks on the line.
Does anyone have any questions for Matt?
What we call stunned silence.
Unmute your phone. All right, excellent. Well, if there's anything that you guys think of that maybe isn't coming directly to you right now, just again put Everwell at the top of it, and put your questions down and make sure that you get those over to us, and we'll make sure we get those answered for you. So thank you, Matt, for that. I appreciate it. Mandy, thank you as well. If there's no questions, we actually have our next presenter coming in at 1:30. So if there's anything that anyone wants to talk about for about 10 minutes here, we have a little bit of a time frame.
Hey, Holly, it's Mike.
Yep.
Can you hear me?
Yes.
Okay. I sent a question through to Matt regarding QSARA, which is the new small employer HRA. When a small employer does not have a health plan, but they want to offer other benefits and allow reimbursement to individuals for health, for individual medical premium. That's what the QSARA is all about, and I know Matt looked like he was searching for it a bit.
I was making sure I knew what it was before I answered your question.
No worries. It's something you'll probably want to think about down the road, but when small employers under 50 in size do not have a group health insurance plan, they're able now to do reimbursement to individuals for premium if they buy their coverage on the exchange, for example. So you might want to think about how Everwell could integrate that provision or allowance in your database and in your enrollment, I guess, platform and enrollment procedure.
Yeah, I think that's an excellent point. I know really what started Everwell in the beginning was Aflac was really good at partnering with brokers and other vendors on our own, but as a company, we never did it universally. I know in Indiana, we partnered with a bunch of brokers when the minimal essential coverage plans were coming out, because obviously we didn't do anything like that, but to have a connection that did, there was a lot of value in the marketplace. So I definitely will take that to the right audience, because I think that's that's a huge plug right now, especially with what's going on in the smaller market.
Right. Thank you.
Thank you.
Oh, by the way, in addition, if you can still hear me, the eventually somebody somewhere is going to have to come up with a compliant plan document for that purpose as well. And I don't know anybody that really has one right now because it's so new.
Mike, can you touch on that a little bit more? So,
Jason, I think I have a couple things with that. Is that the Section 105? Is that what you're talking about, Mike?
Well, it is related to Section 105, but it is a new provision that became law in December of 2016 when the feds passed the 21st Century Cures Act. And what it allows is, or actually what it reinstated, was the ability for an employer to pay an employee back for individual premiums. That was not allowed for a couple of years by IRS ruling. And now it is allowed again, but there's notices that are required. There's an employee acknowledgement that they're in a QSERA, and then there's also a requirement to have a plan document in place. But because it's so new, we don't know of anybody that's actually created a plan document yet. So go ahead.
So is that, Mike, and the question is that I would throw back is that what Zane Benefits was doing years ago?
Yeah.
And then kind of pulled back because of the fact that
yes, exactly. They had to pull back because they were advised by the IRS that what they were doing was not allowable any longer. And that goes back to about 2013.
Okay. I know from, I think Task, Madison, Wisconsin-based Task, had a white paper that supported that it was legal. And then I think the pressure got a little hot, and I don't think they wanted to support or validate that.
Right.
So that's definitely a great takeaway for this.
Yeah.
And Jason, this is Mandy. Yep. I've been working with Teresa Jones on this and Aflac lawyers on getting some documentation on this as well. So when I get that, I'll share that with you and Holly, and of course Matt Cook. So, but we're working on getting some information on that.
Thank you, Mandy.
Kyle Reese, Employee Navigator, just called in.
Hi, Kyle. We're just wrapping up right here.
Perfect.
So that was all I had, Holly. Thank you.
Thank you. Excellent. Thank you, Mandy. Kyle Reese is with Employee Navigator. He is the Director of Business Development. And Kyle, I'm going to make you the presenter here.
Okay.
So you should be able to share your screen now. There we go. Perfect. And again, we're giving you 20 to 25 minutes with a 5-minute Q&A at the end. Oh, there we go.
Perfect.
So it is your show. Go ahead. Thank you for joining us.
Absolutely. Give me 1 second. Let me just make sure my PowerPoint is up. And so you guys are seeing PowerPoint, correct?
Yes.
Okay, perfect. So let me take, before we jump into the system, let me take 5 minutes and just give you a little bit of background on us, and then we can jump into the software and you can see what's under the hood. So Employee Navigator was founded in 2008 as a pretty traditional benefits administration firm. And what that means to us is we charge the typical per employee per month fees, setup fees, implementation fees, et cetera. And we did all of the work for the brokers and their clients. And we typically worked upmarket, a couple hundred lives and up. And early 2012, we came to the conclusion that that is a pretty unattractive business model for a whole bunch of reasons. But that more importantly, the real opportunity for a software company like us was not to go into a broker's office and try to work with the handful of large clients that every broker has, but how do we get our software being used by 90% of a broker's book of business? So in order to do that, we made a couple changes to our business. One was to our licensing structure, and we basically just moved over to a flat fee model where we told brokers, hey, you can have our software for one flat fee. We don't care how many groups you put on, employees, HR users, broker users, it doesn't matter. You pay us a flat fee and that's it. The other big change that we made was in how the system was serviced. We knew that long term there'd be no way for us to do all of the setup and administration in-house. And so we moved over to a self-service model and basically told brokers, we're going to train you on how to use our software. We're going to help you when you have questions or issues, but we're not any more likely to go in and build a medical plan for a broker than we would be to log in on behalf of HR and terminate an employee on their behalf. Fast forward a few years after that, we also came to a conclusion that we couldn't just be benefits. So over the past 2 years, year and a half, 2 years, we've started to build out additional HR functionality, including things like onboarding, time off tracking, asset tracking, ACA reporting, and ultimately we'd like to give HR a more holistic solution as opposed to just sort of a siloed benefit solution. Just so everybody's aware of our pricing, we have 4 different tiers of licenses. I'm not going to go into this in any amount of detail, but I just want everybody to kind of understand the structure. We have an annual license fee and an annual support fee, and that's it. The broker pays those, up to $8,300 a year typically, and they have the software for as many groups as they'd like. We do also have a monthly option, which allows brokers to, if they've had a bad relationship with somebody in our space in the past, they can pay monthly, and if they're not happy after 4 months, they can terminate on the spot. Just some high-level statistics on sort of our numbers. So right now, there's over 3 million employees on the system. There's over 20,000 companies, and there's over $8 billion in in-force premium. And I would say 98% of that has come since we moved to the self-service model in 2012. Why are we growing? We also believe that we're at a sort of inflection point in our industry where brokers having benefits and HR software is no longer an option. It's table stakes. It's becoming increasingly difficult to retain new clients or to go out and win new business if you don't have some sort of technology solution that you're bringing to the table. And that technology solution could do a whole bunch of different things. We're not saying that every group falls into the same bucket, but brokers increasingly need to have that type of technology offering for their clients. And finally, what does our sort of ideal broker solution look like, or what do we think the things that brokers should be paying attention to are when they're evaluating systems? So one, we think that long-term brokers are going to select one system that works with 90% of their groups. You're not going to see a broker try and become an expert in 7 or 8 or 10 different benefits or HR systems. We think that brokers will put most of their groups on us solution, and then they'll have one-offs for the large clients that need custom builds or who are on a system that they've been on for a long time. But we see consolidation occurring within agencies. We don't think that the system can be owned by insurance carriers or competing brokers, because once you do that, the other parties aren't going to want to join the marketplace. So if Employee Navigator was owned by United Healthcare, which we're not, Aetna isn't going to want to work with something that's owned by United Healthcare. And those integrated products won't exist. Likewise, if a solution is owned by a broker, the other brokers in the United States aren't going to want to put their book of business on a competing solution. And because you have fewer users, insurance carriers are not going to be as attracted to that platform. The system has to be low cost. We think that the traditional model of PEPM fees is entirely unscalable as a broker transitions their entire book of business online. It might have been okay for the handful of large clients. And ultimately, we also think that brokers have to be in control of their solution. If you believe that technology like this is going to become increasingly important to the broker-client relationship, then it follows for us that brokers are going to want more control over that solution, not less. And so we don't think there's a tremendous amount of enthusiasm for brokers as they move down that path to want to outsource control of that software to a third party. They're going to want to control all of that. So what I'm going to do now is back out of this PowerPoint, and I'm going to spend a couple minutes just jumping through a few different areas in the software. Where I'm going to start is on the employee side. So hopefully the most basic part of the system. How does an employee enroll in their benefits, request time off, view policy information, qualifying event changes, etc. And then from there, we can jump back up to sort of the broker/HR side of the system. So I'm going to log in right now as an employee. Right now, I'm logged in as Michael Scott, who works at Dunder Mifflin, and this is where Michael's going to come to do whatever this employee has to see or do, update benefits, request time off, etc. This is my employee window into the system. Admittedly, we are not trying to reinvent the wheel here, so hopefully all of this makes sense to everybody very quickly. From an enrollment standpoint, as long as I'm in my new hire or open enrollment window, I can walk through this process. And the process starts out very simply by employees just confirming some basic demographic information, and they'll do the same for their dependents. Usually this information has already been imported in so that the employees are just confirming that it's correct, but they can add or edit on their own if they have to. If I go down to the benefits that I'm eligible for, I have a medical plan here where there's a little overview that might be summarizing the options. I have my dependents, who am I enrolling, and in this case there are 3 different medical plans that I'm eligible for. For any of the benefits, you'll notice as I add dependents, the rates automatically recalculate for me. I have my current election on the right, plan documents on the right. Somebody might have dropped in a video for the employees to view, and then they can also click in and see details about a specific plan. So if I click into details for this Blue Cross HMO, I have a little summary up top, deductibles and copays, costs, eligibility, resources, links, documents, etc. As much or as little as the broker wanted to provide. And then if those deductibles and copays are added in, the system will automatically generate a plan comparison for the employees. So just costs, deductibles, and copays across the board. The basic idea is really simple though. I'm going to pick my dependents, pick my plan, and save it and continue. Or maybe I decline coverage because I'm covered under another plan. If I jump down to dental and I want to enroll in this benefit, hopefully this page looks somewhat familiar to everybody. I have my overview here. I have my dependents. I'm only eligible for 1 dental plan. I can add those dependents to coverage. I have my current election. I can select this plan and save it, or I can decline coverage. If I go down to vision, hopefully you're starting to see a pattern here. I have an overview of my vision plan. I have my dependents, 1 plan that I'm eligible for, my current election. I can see any plan details, save it and continue, or decline. I'm going to jump down to Vol Life and give you an example of a plan that looks a little bit different because Vol Life can obviously be more complex than a basic dental plan. In this instance, to select my benefit amount, I actually have to drag this ball around. So for this plan, $50,000 is my GI. If I go over that, let's say I go to 200, we're letting the employees know that they've been approved for 50 at 7 per pay. I've requested 200,000 at 28 per pay if that's approved. A notification automatically goes out to the broker and or the HR letting them know that there is a pending EOI, and we'll also now have to alert the employee that they have to complete an EOI form. So the basic idea is simple. Walk through each of these benefits, elect or decline coverage. When I'm done electing coverage, I might have to complete some additional information. An example would be adding in beneficiaries. However, if the plans that I elected coverage for don't require beneficiary designations, then this field would fall off if I wouldn't see it. And then when they finish, they get to an enrollment summary. Typically on this page, inside this green box, I have to agree and complete, confirm my elections. I've already done that in this case. We've itemized each of the employees' elections below here. I can see my total per pay costs, dependent elections, decline coverages. I can print this page out for my records. The system will automatically generate a total comp statement for the employees. And from an enrollment standpoint, that's it. The only thing that would change for an employee mid-year if they're not in open enrollment or they're not a new hire is that this update benefits button would collapse away. So that's the basic enrollment process, again, regardless of whether it's open enrollment or new hire. If I click into benefits mid-year and I need to add in a qualifying life event, I can do that here. HR will be notified and will ultimately have to approve or decline that event. I can view my total comp statements, my beneficiaries, my enrollment summary. All of the policy information that I looked at during the enrollment process is available to me year-round, not just at open enrollment. We also capture quite a bit more information on employees, and this sort of gets into the HR space in terms of the types of information they want to capture versus the more limited information that a broker might want on a client. So we have basic personal and dependent information up top, but then you get down to emergency contacts and job roles and responsibilities and licenses and certificates and education history. HR can track quite a bit more than is required just for a purely benefits related piece of software. And what we're hearing from HR is they want to essentially digitize their filing cabinets. And so we want to give them a space to do that. So you have basic profile information, benefits information. I can come in here and request time off as an employee if that's set up. Select my leave type, the dates that I'm taking off. I might select a partial day, give my time off reason, submit my request, and HR can actually approve or decline that request from their inbox. They don't even have to log into the system to do that. I can see how much time off I have remaining this year, my remaining balance, any time that I've previously taken off. I can see my company holiday calendar. So if I go back to 2016, here's my company holiday calendar. I can see a summary of my company's PTO packages and policies because I might be involved in more than one package simultaneously. So I'd say generally we're not trying to reinvent the wheel with what an employee can see or do in our system. We're not under any illusion that benefits in HR is a destination website where employees are going to come on a Wednesday afternoon because they're bored. We very much want employees to be able to get through whatever it is they have to get through quickly and efficiently. And our focus is more on making sure that HR is coming in every day and we're able to save them a whole bunch of time completing their tasks as well. What I'm going to do right now is log out as the employee, and I'm going to go into a company's HR page. So I'm going to log back in, and I'm going to search for the same company that Michael Scott is employed by, Dunder Mifflin. So this is the HR dashboard for a specific company. If an HR manager for Dunder Mifflin logs in, this is where they're going to land. And that HR manager might be doing any number of things like adding a new hire, terminating an employee, running a report, managing onboarding, uploading HR documents, etc. This is the HR's window into the system. Likewise, this is also where the broker would come to manage this group. So HR and broker are looking at the exact same thing. Ultimately, the broker can control what the HR can and can't do. So a broker might come in and manage ACA or set up a benefit, but they're going to be looking at the same screens. One of the items that I did want to touch on that we didn't look at on the employee side is new hire onboarding. We essentially built this tool for ourselves because we found that hiring a lot of people quickly was just cumbersome on our HR team. So we started by building out a list of tasks that we thought essentially all new hires throughout the country would need to complete. Does the HR want to collect the new hire's address? Do they want to collect it withholding information, emergency contacts, EEOC information, etc.? All of these tasks are built into Employee Navigator by default and can be turned on or off by simply clicking on or off. We also recognize that there's no way for Employee Navigator to anticipate every compliance or onboarding task that every employer is going to want to complete. So on top of the existing tasks that we built in, we gave HR the ability to create their own custom tasks and add those into the workflow. So let's say, for example, that this company needs new hires to watch an OSHA video. They can give the task a name, they can give it a description, they can tell the system who it applies to. Is this task for everybody, or is this task only for my operations team, no one else? And then I can say I need the employees to acknowledge that they watched a video, give the video a name, drop in the URL, save it, And this task then gets added into the existing workflow so that every new hire is going to have to complete that task in addition to anything else that's been turned on. And then HR obviously also has the ability to view any incomplete tasks. In this case, I have some really lazy employees. There are 695 incomplete tasks. I can send out reminders to those employees, or I can search for specific tasks that specific employees haven't completed. So maybe I want to see everybody who has not added in their address. Or maybe I want to search for one employee and see what they haven't done. So Wilson Abner still has to complete his W-4 and his background check information. And I can manage these tasks individually as well. What I'm going to do right now is jump over to I'm going to search for an employee so you can kind of get a sense for how an HR might manage an employee individually. So I'm going to search for Michael Scott. We were logged in as Michael's employee earlier. And this is the HR dashboard for Michael Scott. HR can do a whole bunch of things here. HR can keep notes on an employee, so can a broker for that matter. And they can attach documents to that note, and they can share that note if need be with either a broker, an HR, or the employee. And those notes are going to be stored historically right down here. I can view and manage all of this employee's profile information. So same basic information that we were seeing as the employee. The only difference is, for example, the employee would never have the ability to update his compensation, whereas the HR obviously can. HR can manage this employee's benefits on their behalf. So maybe this HR has told their employees, I don't want you to come in and make qualifying life events in the system on your own. I want you to come to me, and I'll make that change in the system on your behalf. HR can come in, make that change on the employee's behalf as opposed to the employee having to do that on their own. This is where HR would come to terminate an employee. I can see any incomplete or outstanding compliance tasks that he has to complete, the tasks that he has completed, etc. So think about this as a window into one employee specifically. If I go back to the main dashboard, I did want to click into reports for a minute. I know it's a pretty dry topic, but I think it is important for everybody to kind of wrap their heads around the types of information that you can ultimately take out of Employee Navigator. What we tell everybody is essentially you have the ability to export any and all information from our system. We don't limit that in any way. So everything from payroll deduction reports to event-based reporting to change-only reports to something as basic as during open enrollment, seeing who's finished their open enrollments, who hasn't finished, who hasn't started, and who can't start. You can also run custom ad hoc reports, and just to give you a sense of how easy that is, I'm going to run one right now. And all you really have to do is tell the system what employee information you want to take out. So I'm going to ask for socials, first name and last name. I'm just going to select a whole bunch of different employee fields. And I'm going to scroll down here just so you can see the scope with which we are tracking employee information. You can get pretty granular. Maybe I'll add in age. And maybe I want to include dependents. I need to go pull this information out to go get a quote. I can click View. And here's all that information on the spot. If I click Download, this exports into Excel. I can make this report much more complex, let's say by tying this employee and dependent information to enrollment information. And I can do that for any of the available benefits. I'm just going to select some basic medical plan information though. But if I scroll down here, you can see you can do it for any type of plan that's available to this group. And because I'm looking at enrollments, I want to tell the system I don't care about people who declined or who didn't enroll. And I want to look at enrollments that occurred between a specific date. So I'm going to create a window here. And then I'm just going to click View. Same general layout. I've just added in more information into this report. I can still click Download, export this out of the system on the spot. I can also save this report so that if I need to come in and run this on a regular basis, I can save it, give it a name, and that saved report is going to sit here under My Reports. So these are all custom reports that that somebody built, and they can run them on the spot without having to recreate them from scratch. I'll also touch on ACA, even though I think there's a little bit of uncertainty about the status of ACA. So we have a full ACA reporting engine that does everything from eligibility tracking to the 1094 and 1095 filing. This year we did just over 1 million 1095s. And the ACA module itself does essentially everything that a company is going to need to get the reporting out at the end of the plan year in January or February. What does that mean? Well, one, we have the ability to do ALE calculations. So you have total employees, full-time equivalents, non-full-time equivalent total hours, etc. We have an affordability calculator where when I select the low-cost plan or a low-cost plan, right now I can see that there are no employees whose costs exceed 9.66% of their salary for this Blue Cross HMO. If there were employees whose costs exceeded 9.66% of their salary, I can see who those employees were, and we're also going to let the HR know that you either have to increase contributions or give pay raises to those employees, and by what amount, in order to get them under that threshold. I can also come in and look at our stability report. So let's say I wanted to see any employees who are trending ineligible. I can see that Quincy Brown is currently trending ineligible. He has worked 124 hours. We've tracked 1 month. I have his measurement start date, his measurement end period, his admin start date, his admin end period, etc. And then for each of these employees, I can click in and see some additional ACA information. So here's his admin period, or his measurement period, his admin period, his ACA demographics. So maybe I want to come in and Quincy was given a promotion, so he goes from variable hour to eligible. I can do that from there. And then I can also manage his hours individually as opposed to importing them in bulk. So I can just add hours here for a specific month. So we've sort of looked at managing employees, ACA, onboarding, the employee side of time off tracking. One of the other important elements of the system that is quite frequently used is our notification engine. So when a broker has 10, 50, 100, 200 clients on the system, they want to know what changes are occurring in real time. And their HR managers also have that same desire specific to their employees. So what we built was a real-time notification engine that alerts either the broker or the HR of any change that they want to be notified of. Those changes can be pushed out to their email, or they can just be stored on what we call the wall here natively. And those notifications can be turned on or off. So maybe during open enrollment, brokers and HR don't want to receive changes about notifications, about enrollment changes because it'll clutter their inbox and they know that everybody's making changes right now. So I can see here that there was a change made in this company by Jackson Brown. His enrollment was changed. When that change happened, I can create tasks associated with that change. And I can also click into details and see the details of what actually happened, including the event, the employment information, the employee information, and any dependent information as well. So HR and brokers now have real-time insight into what's being done by the employees. Again, the only difference being brokers receive these notifications potentially across multiple companies. HR's wall is specific to their employees. So from 30,000 feet, that's a fairly good overview of sort of what's inside the system. The one other thing that I did want to bring to everyone's attention is something that we're developing called our marketplace. And what I would liken this to is an app store for Employee Navigator. There are a variety of products and services that people would like delivered to brokers, to HR, or to employees ultimately. And so what we've started to do on the back end of our software is open it up to a whole bunch of third parties so that those third parties can integrate with us and deliver whatever it is they want delivered to their clients. An example would be COBRA administration. Employee Navigator does not want to be in the business of being a TPA administering COBRA. but we do want that to be something that HR can accomplish in our system so they can spend less time dealing with that. So if I click into COBRA here, we've begun to add a whole bunch of integrated COBRA partners so that HR or maybe a broker can connect this partner with a specific client. And for example, when an employee is terminated in Employee Navigator, that COBRA notification goes out automatically. Where we're a little bit different on this marketplace is that we're agnostic. We do not want to pick 1 or 2 or 3 vendors in a specific category and dictate to all of the brokers and employers in the United States that they have to use those vendors. We believe that in order for this to work, we have to be an agnostic middleman. And so all of the software that we've written on the back end of our software allows us to integrate with anybody who is technically capable of consuming the data that we're sending them, whether it's a TPA or an insurance carrier or a payroll company or an identity theft provider. We want to remain agnostic and create a really broad marketplace of integrated partners. So I think we were going to leave like 5 minutes-ish for questions. I think that's all that I wanted to cover in the call today. So I want to kind of open it up and see if anybody had questions.
Thank you, Kyle. Does anyone have questions for Kyle?
Holly, this is Mike, or was that Mandy? I'm not sure. The question is regarding payroll. You showed a tab up at the top that said payroll, but you didn't demo that at all. So Is this a fully integrated payroll system as well?
It is fully integrated. We do not administer payroll any more than we administer COBRA. But in the same way that there's a list of COBRA vendors that we work with, we are also opening up a payroll API to be able to partner with any payroll company who is able to work with us. COBRA for us was first, so we have more vendors. Right now, the first 2 payroll companies that are live are Benefit Mall and Paylocity. Everybody else here is currently in testing, and it's denoted by this little orange or green icon at the top here. So someone is connected, someone is pending. I would anticipate by the end of this year, there are about 24 fully connected payroll companies. And what that means is a real-time exchange of demographic and deduction information. We're not exchanging files, we're exchanging data in real time.
And then I'll assume that the pricing for any one of those services is going to be up to that partner, and you're agnostic about that as well.
Correct. We do not interject ourselves into that conversation. We do not charge to use an integration. But for example, if you're using Paylocity, you're still going to be paying Paylocity whatever you've been paying to have them process your payroll. But there's no connection fee or anything like that from Employee Navigator.
Very good.
I know Tony has joined. Yeah, I know Tony has joined, so I just want to make everyone aware that B-Swift is on the phone. Any other questions for Kyle? Again, if you have additional questions and you didn't get them answered, shoot them over to me. I'll get them to Kyle and I'll get your questions answered.
Okay, well, thank you, everybody. I appreciate your time and have a nice afternoon.
Thank you, Kyle. We appreciate it. Thank you so much.
Bye.
Bye-bye. All right. Tony, you are on, correct?
I am. Welcome. Hello.
Okay, so we have Tony Fox from B-Swift. He's the VP of Sales and Development. I'm going to give him access here. You'll be able to see his screen in a second. All right. Tony, the floor is yours. Thank you for joining us.
Hey, thank you very much. Again, my name is Tony Fox from B-Swift, and thanks for giving me the opportunity to show you some of the best and brightest of B-Swift here. What I'm going to be focusing on is the employee enrollment perspective of the open enrollment status. What I will not be talking about in the half hour I have allotted to me are things like the administrative efficiency that an HR department might gain from using B-Swift. I will also not be talking about ACA. and our full compliance suite. And I probably won't be spending a lot of time on reporting and dashboards. If there is a genuine desire to have me go into that, let me know. And if I have time at the end, I'll be happy to do so. Otherwise, I'm going to progress from the employee perspective. And I will pause it for 1 second to let you decide which way to push me. All right, I'm not getting any pushing. That means I'm going directly into the employee perspective. And what you're seeing right here, now I should pause for a moment. Can everybody see my screen? I'm kind of scrolling up and down here.
Yes, we can see it.
Perfect. Okay, great. So what you're going to see here, this is what we refer to as the employee landing page. Now, the employee would have access to this piece of the site, and this would largely be determined, meaning the look and the feel, by the employer group, maybe with the HR staff at the employer group, and with generally whoever owns the entire process. This is a purposefully busy version of our employee landing page. I'm going to go through a little bit of what you see here in a second. But it's meant to be purposely busy to show you a little bit of the scope of what we can do on the employee landing page. For example, you see in the upper left-hand corner, we have my demo site name, CP Visual. It could be any different type of employer site you wanted to see. We could do it in this color. We can make changes to the look, the font, the feel. Long story short, we can make it identify with the branding of your employer group. We can have the ability to show custom video on the front end. So for example, if one of your CEOs or CFOs has a message they want to get across, we can have this autoplay when the employee lands on their landing page. We have the ability to add custom text at various pieces throughout the process. It doesn't have to be text. It can be a link if you choose. For example, this one says mobile benefits, which kind of cues me to tell you that everything that you're going to watch me do today can be done via mobile. So for example, we understand that most people in what we call the millennial age group tend to access data via their smartphone. We also understand that a large population, a large percentage of the modern workforce is either going to be or already is in that millennial subgrouping. They tend to like to use their smartphones. You can do anything that I'm about to show you over the smartphone. Again, we're going to have some pieces of rotating artwork. Those can be absolutely customized. We can have questions. We can have links. We can have links out to documents as well. My Benefits Quick Look, this is an example of what the employee has enrolled for. You'll notice it's totally blank right now because we haven't enrolled anything on this employee as of yet. The employee can take care of life events if they choose to do so, make changes to their family, edit their profile, and all that good type of stuff. All that's easily done off of simple landing pages, and it's very easily configurable, and we can include a lot of functionality. What I'm going to do, though, is I'm going to jump into the enrollment process. And as I jump into the enrollment process with a simple Start My Enrollment button, what you're going to see happening here, oh, 1 second. No, we're still sharing, so that's good. Okay. You're going to see a reference to what we call Ask Emma. So what I'm about to show you is our decision support tool, and it's known as Best Fit/Ask Emma. Best Fit is really the algorithm by which we help determine, given a number of choices, what the best plan is for a given employee. And the simple metric we use is lowest maximum out-of-pocket cost. And I'll tell you how we get there as we go through the process. The person you're going to hear talking and sharing a little bit of microphone time with me is Ask Emma. She's the avatar that goes along with the process. She's very heavy into education. And what that means to you is that pretty much every employee that goes through this process, at the end of it, will possess at least a rudimentary knowledge of benefits and the different pieces that can affect them on a day-to-day basis. So I have Emma set up here. I'm going to click Let's Go. And then,
There, it's Emma. Let's get started. Choose one of the benefits below and we can dive into the details.
so real quickly, could everybody hear Emma there? Could one person
Yes.
hear Emma? Okay, perfect. Thank you.
Yeah.
Okay, so what you're going to see here is this is where the employee would land when they're in a typical open enrollment. So if we take a look at this, we've set this up to be a fairly simple, but a little bit broad representation of what an employee might see on an open enrollment. So we have medical up at the top, we have Accident Advantage Plus, critical illness, dental, basic employee life, supplemental employee life, and so on and so forth. This can be as complicated as you want it to be. You can also have the ability to vary the positioning of these different products. So let's say, for example, this is the first time the employee would ever see medical. It's probably appropriate that it be the first thing they jump into because medical is widely considered to be one of the more important benefits. Let's say, for example, it's the second year and there have been no changes whatsoever, but you're offering a brand new, maybe a critical illness plan and an Accident Advantage Plus. You would have the ability to push those forward in the queue to occur to the employee before the medical does. So again, there's a lot of flexibility in the way we portray this information to the employee. And again, we can get very complex and we can get very broad in terms of the employee benefits we offer. Now, for the purposes of this, I'm going to hop into the medical. I'm going to view my plan options. First thing it's going to do for me is take a look at who I want to have covered. This is Tony Tester. I can also include Sam Sample, who I guess is my spouse. I didn't really marry somebody named Sam Sample, just to let you guys know. And then Child Sample as well. And I promise we would have named the kid something better. Now I'm going to continue.
If you're thinking, which plan is best for me, and you need a hand, just click this button. You can also look things up one by one with the FAQ.
So I'm going to click that I got it. And what we're going to see are our different medical plan options here. And again, because this is a demo, we have more than a few on offer. And we also have the ability to waive right here. One key point here is that you have the ability to report on any acts made within the system. So let's say, for example, you want a waiver report. You can very easily run a report that's going to show all the employees that waived. If you wanted a report that shows everybody that took this bronze Cigna Providence 4000 HSA, that's fine as well. But since we're in the medical piece, let's look at some of the functionality here. Now, again, you have the very basic pieces here, deductibles, out-of-pocket max or accumulators, co-insurances, things along those lines. But if I'm an employee that doesn't really understand how this works, I'm typically going to ask Emma which plan is best for me.
All right, let's find the plan that best fits your needs. All you have to do is answer a few questions about your expected medical needs during the period of time you'll be covered. This period is sometimes called the plan year. In turn, you'll get an estimate of the total cost you'd end up paying in premiums, medical bills, etc. under each plan, as well as a plan recommendation based on whichever plan is estimated to cost you the least. Before we move on, remember, if you want to skip all the explanations and run the numbers yourself, you can use this handy calculator. Want to learn more about how that total cost estimate is made?
Now I'm going to click no on this because I'm going to give you a pretty brief overview of how we do this. Again, the end metric is to look at each of the medical plans that are on offer. And again, this also works with things like critical illness. It works with different pieces like dental and vision as well. What we do is we take what we call the parameters most indicative of a medical plan out-of-pocket cost, and we ask the employee a number of questions. At the end of it, we're going to have the employee's demographics. We're going to have the answers to a number of questions that you're going to see me go through right here. And we're going to have the plan structure of the different plans. We will estimate the maximum out-of-pocket cost per plan. And again, as I mentioned before, the plan with the lowest maximum out-of-pocket cost estimate is going to be designated as the best fit. And we're going to see all that. I just wanted to tell you why I'm going to click no and continue.
Now, to kick things off, remember, the answers you give here will not be shared with your employer or coverage provider, and they also will not affect the premiums or other limits within the plan. So, specialists. Specialists can be pretty much any type of health provider that isn't your primary care physician. Anything from cardiologists to chiropractors. But some types of specialists may be treated differently by some coverage plans, depending on what your employer offers. Mental health providers may fall into that specialist group, depending on your employer's plan details. Psychologists, psychiatrists, social workers, those kinds of providers. Expecting any mental health visits? And just to reiterate, your answers will not affect the premiums or other limits within the plan, and your answers will be kept private.
You're going to notice that Emma keeps talking about keeping answers private, and that's to address a very real concern when it comes to internet-based applications and general level of employees. They're going to be concerned about data breach. They're going to be concerned about entering information. That's why Emma keeps referring to the fact that everything will be kept private. Really, the HR person, the only way they would be able to access any of this information would be in a de-identified and aggregated version in kind of an overarching style report. Just for the sake of brevity, I'm going to click this as no for mental health and hit continue.
Okay, chiropractor visits can also fall under special rules. Do you think you'll visit a chiropractor during the plan year?
Again, just for the sake of brevity, I'll say no. Oh, I will be clicking some later.
That leaves, well, every other type of specialist. Any other specialist visits we need to account for.
I'm going to click yes.
All right. How often will you be seeing other specialists, not including the mental health practitioners and chiropractors we already talked about?
So I'm going to say Sam is going to be the one that doesn't really need to see everybody. And I'm going to say Tony and Child need to go see one every few months. You can, if you're paying attention, you can probably kind of see where we're going with this. We're starting to ask differentials.
Want me to factor the cost of having a baby into your out-of-pocket estimate?
I can't click no fast enough.
Have any surgeries planned for the plan year?
And for this one, I'm going to click yes.
How many? Keep in mind we've got two different kinds. Outpatient surgery, where you go home the same day, and inpatient surgery, where you stay in the hospital after the surgery for at least one night. If you aren't sure what type of surgery it is, it's safer to mark it as inpatient so you don't underinsure.
So I'm going to set myself up for not a very fun year, give myself an inpatient and an outpatient, and hit continue.
Do you or anyone you're covering have any ongoing prescriptions? All right, so there are two major classes of prescriptions we'll focus on to make a cost estimate for you. Brand name drugs, which are usually more expensive, and generic drugs, which are usually less expensive, even though they have the same active ingredients as the brand name drugs. If you aren't sure whether a drug is generic or not, it's probably safer to mark it as a brand name.
So you'll hear, number one, Emma takes a stab at the concept of therapeutical equivalency, which is great. I think you can see where we're going here. We're asking for brand name versus generic drugs. We're asking for inpatient versus outpatient surgeries. We're asking for numbers of specialists. What that does is it gives our database a better idea of the medical costs an employee might incur outside of his insured benefits. Again, brand name prescriptions are generally going to be much more expensive than their generic counterparts. Generally speaking, I know that there are exceptions to that. So that's why we ask these type of questions. As I hit continue.
All right, that wraps the health questions. So we can nail down costs. But there's more to these plans than the numbers. To choose the best plan, we'll need to go over a few features that affect the way the plans you're eligible for work, and even which one I recommend. To start, I need to make sure you're familiar with some important insurance terms. Otherwise, this could all sound like gibberish. Just put a check mark next to all the words with the correct definition, and then hit continue when you're done.
So again, some of you are going to have an employee base that isn't necessarily working with benefits on a day in and day out basis. Like Emma said, it runs the risk of all sounding like gibberish unless you know a couple of generic terms, like premium, deductible, coinsurance. So knowing that Emma would never try to put one over on me, I'm pretty sure premium and coinsurance look right. I'm not really sure about those other ones, so I'm going to hit continue.
Okay, I'm the worst. That was a trick question. They were all correct.
Oh, Emma.
If you want to review, here are the definitions. To go on, click continue and we'll get you to that estimate.
Again, simple definitions for simple concepts, just so people that don't have a focus on benefits understand what we're talking about.
Okay, so when you enroll in health coverage, you should know that sometimes there are special accounts that help you cover certain health costs. There's an account that allows you and others to contribute money you can use to help pay qualified health expenses, as well as save money for retirement. It's called a health savings account, or HSA. Are you up to speed on how an HSA works?
Now I'm going to click that I am, again for the sake of time, because I know my time is short today. Had I clicked no, it would bounce out to a video that is a little bit cartoonish, but it's very educational, and that's meant to engage the employee. It takes a difficult concept to understand for somebody that's not in benefits and makes it accessible and makes it understandable. When using Ask Emma, in the first year an employer group offers an HSA, we typically achieve 35 to 40% penetration on the HDHP program selection. That's versus the national penetration of roughly 5 to 7%. Our educating the employee leads to greater adoption, which in turn leads to lower claim cost for the employer group.
Plans with an HSA are marked with this.
I'm going to click through a couple of these.
There's an account that helps you pay qualified health expenses.
That's FSA. We're going to bounce through that.
Do you feel you know enough about how an HRA works?
I do.
Plans with an HRA are marked with this check. So keep this in mind. Using funds from an account like this. Now, when it comes to networks.
Okay, we're going to skip past a good chunk of that just because we want to make sure we get to the end within time.
Larger networks may offer. When providers group together.
Emma really likes talking about networks and ACOs.
I've got a summary of all your expected medical needs here, based on what you told me. If you need to make a change, this is the perfect time to do it. Otherwise, let's get your estimate.
And the employee can bounce back into different points in the process, go ahead and make edits, add specific additional medical services if they choose, or simply click the button and get a cost estimate.
Here we go.
Okay, so you will see up at the top here, there is one plan that has a big green box around it. And what that means, that is the best fit plan, meaning this is going to be the lowest estimated annual total cost plan. So if you look at this, we'll annualize the premium, as I'm mousing over here. We'll show the estimated annual out-of-pocket spending. And by the way, that $7,000 represents the cap, the out-of-pocket cap in the plan we built for this demonstration, giving us a total estimated annual cost of $14,394. You'll see it's lower than the other plans that we have on offer. That's why this is designated the best fit. Now, if I choose to do so, I can look at all of them. If I make my decisions in a different way, let's hide this real quickly here. What we can do is we can just look at the plan side by side if we tend to reach our decisions in a different manner. And again, this can be as nitty-gritty as you choose it to be. I'm going to go ahead and hit select on the Bronze Providence or HSA program, and I've made this selection. We always show the cost per month to the employee. We also always show the employer contribution, simply because the first time employees learn of what the employer pays for their plan is usually after they quit and get their first COBRA bill. So we like to make sure the employer is getting their due. You can apply credits and surcharges to the process as well. Surcharge for smoking is the most typical, or a credit for inclusion in a wellness program. And again, we can break this out per month. We can break this out per paycheck. Kind of up to you, the way we design that. Now, I've made my medical decision. The next one in line is going to be Accident Advantage Plus. So I'm going to take a look at that real quickly, and I'm not going to go through all of these. Oh, here we go.
Got the details below, and this video to go with it.
So this is an example of the Accident Advantage Plus. We have it tied to Aflac. We would show the cost per month. We always show the employer contribution. This is obviously a worksite plan, so it has no contribution on it. Now let's say I have Accident Advantage Plus, and I'm not really sure what that is. I can go ahead and watch the video. And I'm going to hit play.
It's hard to tell when an accident might happen, but it's easy to be financially prepared in case something ever happens to you, because the cost of treating an injury like these can be expensive. And even though your health insurance helps pay your medical bills, you still might have many expenses that aren't covered by your plan. Things like co-pays and deductibles, transportation to and from treatments, child care expenses, and more. You have to pay those bills yourself, and that could be a strain on your savings and have a serious impact on your retirement nest egg. Plus, if you're unable to work while recovering from your injury, that loss of income could add further stress in figuring out your finances. But with accident insurance, if you have an accident that's covered by your policy, you'll receive a cash payment that can help fill in those financial gaps. And you can spend that money on anything you want, from medical costs and therapy fees not covered by your health insurance, to personal expenses like your rent, your mortgage, car payments, grocery and utility bills. Accident insurance provides extra cash at a time when you need it most. So instead of worrying about your finances, you can focus on your recovery. Be sure to review the details of your specific policy for more information.
So again, that's a good example of one of the videos that takes a potentially complex concept, meaning accident insurance, and tries to make it accessible for an employee that might not know much about it. So for in this example, it's meant to be at a fairly high level, and then if there were any specifics to our Aflac policy that needed to be called out, we can either call that out in text, and let me close this real quickly here. We can go ahead and put that down in text here. We can put different affirmations and attestations during that text as well. So we have a lot of options by which we can get the concept of Accident Advantage Plus across to that employee, make them understand what they're looking at, and again, enable them to buy it with full transparency as to the cost. We can also enable them to waive it if they chose. I'm going to go ahead and select it. Now, the last benefit I want to hop into here, I'm just going to jump into critical illness very quickly.
Critical illness. Check out the plan and the video here if you want a quick overview.
Okay, again, I'm only going to go through part of the video just so you understand that we do have one for pretty much everything.
Thanks to the wonders of modern medicine, the chances of you surviving a serious illness like a heart attack or stroke have never been better, but advanced treatments are getting more expensive.
So again, I just want to make sure that you understand we have the ability to approach employees on an understandable level, pretty much on any type of benefit available, especially the worksite type of products. Again, this is an Aflac plan. I'm going to go ahead and select it. And it's going to lead me to a calculator. So how much do I want? I'm going to have a choice here of 5,000, 10,000, all the way up to 40. Let's pick 35. It shows me my cost, and I can hit continue. It's going to ask me a series of questions. And again, if the plan requires a certain amount of questions, that's fine. We can accommodate that. If it doesn't require questions, then we don't necessarily need to include these. This is asking if I'm covered by an individual or group policy that provides primary medical, not designed to be supplemental. I'm going to say no. What the heck? I'm going to say yes. And I'm going to hit save my answer.
All right. What would you like to check out next?
And again, she's going to direct me as I go through these different pieces of the puzzle. Okay? Now, just for the purposes of this, I'm going to go ahead and waive the ones that I haven't picked because I want the ability to show you what the confirmation statement looks like. So I'm going to hit continue from here. And here it's asking me if I want to put in a PCP or go to the provider website on medical. I'm going to hit continue and pass this up. I need to choose my beneficiaries on my critical illness. I'm going to keep this at the 100%. I can add new beneficiaries if I choose. My employee life, same concept. I'm going to hit continue. Oh, wait, I'm sorry, I must have, oh, okay. And I need to review my selections. So at this point, it looks at all the different pieces that I have. For example, I'm getting a little warning on medical because I'm covering an unverified dependent. What that means is we've set up a type of dependent audit on this program and that I need to pend this until my HR approves it. So it tells me what my cost is per month on the employee level because I'm entitled. And it tells me what my pending cost per month would be provided my employee or my family gets approved as well. Shows the Accident Advantage Plus, the critical illness, and all the other pieces that I waived. I do have to click an attestation box, and the entire process will not be finished until I do so, and I complete enrollment. So as I do that, I'm going to come to my confirmation statement. Again, it's going to give me a reminder on the medical that my family coverage is pending. I can view this, I can print it, or if I had an active email address in the system, I could email it as well. And this would be my confirmation statement from an employee perspective. Now, again, I went through things relatively quickly, but I showed you the employee landing page. I also showed you the employee process by which they would elect medical, get educated along those lines, and then we talked about a couple of different worksite policies from Aflac. Does anybody have any questions about anything I've gone over so far? I will take the deafening silence as a no. I will say that, again, this is fairly simple, nice and easy to take care of. I do want to show you something else very briefly. And let's see, I timed out on this other page, so if you'll be so kind as to give me 1 second. What I want to show you is a little bit of the reporting and a little bit of our ability to comply with all ACA type of legislation. So I'm going to go into one of my demonstrations. And by the way, any type of Social Security numbers or any type of information you see in these demonstration sites, those are fake, so you are not being exposed to any PHI or PII. Now, on this is where the HR person might land on a day-to-day basis. You have all the simple administration tools, company libraries where you might keep special forms, custom video, things along those lines. All the simple tools up to and including sending emails from this system. So for example, if you have a large group with a couple of different divisions and you'd like to only contact one division and maybe send them, I don't know, some type of ethics approval form or something along those lines, you can send out an email to that specific division as long as you have it set up in the system. Activity stream, I'm not there, so I can't see which hands are going to be raised, but if you're a data geek, do me a favor and raise your hand. I don't even know why I asked that. I can't see anything. But if you're a data geek, this activity stream is going to be one of your favorite pieces. What this does is this tells you if you're importing information into bSwift or exporting it out to a carrier or out to another partner, this tells you in real time if that information has completed. You get a little green check mark. If it's completed with errors, we give it the red exclamation point because you still got to look at it. Or if it's bombed out entirely, and we call it canceled. This is the way you keep your finger on the pulse of your data going back and forth. So you always know if the information in the system is accurate or if it's missing an update. Real quickly, on the dashboards, we have over 350 standard HR style reports. We break them down in different categories. For example, we can show, let's see, all of your favorite billing reports, your benefit, activity, admin. They're all broken down to be nice and easy. Every one of the reports you see in the system can also be tagged to run at a certain time of the week, and it will reach out to the HR person to let them know, hey, your report ran, come back behind the firewall and look at the information. Again, you can receive an alert to that effect when you're the HR person. So it lets the HR person sit back and passively receive the information rather than having to go into the system and hunt and peck and find it. We don't just have reports, we also have a full suite of dashboards. And the dashboards are for maybe when that CFO ducks their head into your office and says, hey, what is our medical participation? I'm thinking about getting rid of that HDHP program. Well, if the HR person can say, actually, ma'am, it looks like 54.5% of our employees are in that policy right now. And knowing that, like you do, that you can click on any data wedge to get a granular report, click on that and receive a full breakout of the information within that data wedge. We have a planned migration map, which is kind of one of my favorites. Let's say, for example, you introduce an HDHP program. It's all well and good to know that people came into it after open enrollment, but it might give you a good thought pattern to know where they came from. Did they all come from the one PPO program you thought was great? Turned out nobody liked it? That's good information for you to have going forward. Break down monthly medical premium. We can give you some insight into your turnover, monthly total logins, benefit plan transactions. We also have an entire suite of dashboards tied only to open enrollment. So for open enrollment, let's say you wanted to find out exactly who had begun their benefit election but not finished, people who had finished and people who hadn't begun. You can run that report and have it show up on your desk at every morning during that open enrollment process, letting you keep your finger on the pulse. We can show you current plan year. When you're in the middle of open enrollment, you probably want to know what your future plan year is going to look like as well. We can show you that information. A lot of information there, and then again, we have the ability for you to fully comply with all ACA legislation, up to and including creation and distribution of the 1095 and the 1094 and its transmission to the IRS. Now it's 2:24. I have 6 minutes left, but I know I came in a little bit early, so I'm probably right up against it. Does anybody have any questions about anything I've gone over? And by the way, I understand it's like drinking from a fire hose. Any questions?
Of course I do.
Go ahead, sir.
Tony, couple of things. First of all, I didn't hear you talk much about exporting employee data out to the carriers once they've made their enrollment choices. Can you talk more about that?
Sure. Yeah, and that's easy as pie, and it's really kind of part and parcel of one of our core strengths. B-Swift really views themselves as a connectivity hub. And if you recall earlier, I talked a little bit about activity stream and your ability to know exactly when that data is being imported into B-Swift or exported out of B-Swift. So let's say, for example, you have ABC Corp, and ABC Corp has a, let's say they have, I don't know, Aflac as their worksite carrier, maybe they have Delta Dental as their dental carrier, and maybe they have Blue Cross of Wisconsin as their medical carrier. We would set up via EDI transmission automatic transactional feeds that would go out to them at a scheduled time each week. We typically go on a weekly basis. If you had a client for whom every other day was necessary or even daily, that's fine. We could set it up to transmit on that type of schedule. Again, it's fully automated. The HR staff or the employees don't need to do anything to make it happen. It's going to happen automatically. Does that answer your question?
Okay. Yeah, but I'm going to ask a little more on,
sure.
On carriers who have agreed to allow the import, I guess, on their end. Do you have everybody, or are there gaps in that, or what?
Maybe you could help me understand what you mean by everybody. If I say that everybody, go ahead.
Nationwide, on a nationwide basis, you know, if we have employers in other states, they're going to have typically whatever their state-based insurance, group insurance plan. So I guess I'm wondering if the capability is built to allow exporting from this website into basically every carrier.
Yeah, and the answer to that question is absolutely. To use an example here, and on my screen I'm showing existing EDI exports. This is how we would set up a vendor interface out to those different groups. So for example, maybe ABC Corp has a large percentage of its population in Wisconsin, but it also has a sizable group in Wyoming and a big chunk of people in New Mexico. What you would do is you would set up an EDI transmission. You would set it up to the Wisconsin carrier, to the Wyoming carrier, and to the New Mexico carrier because they need to receive that information independently. And again, it would be automated. You could set up at what time of week it went over. You can set it up so the HR person does need to click a button to transmit it. That's a way to kind of insert a pause into the process. But the standard is to set it up on a regularly scheduled basis, again, typically once a week. And no matter how many states an employer group covers, we can set up any number of different vendor interfaces. Is that a little more clear?
Yes, absolutely. Thank you. One last quick question, and that is B-Swift an independent company, or are you owned by a carrier or some other entity these days?
Yeah, we were an independent company up until, I want to say, the middle of 2015, at which point we were acquired by Aetna Incorporated. It's a very large insurance company. I'm sure most of you have heard about it. I will say this, Aetna has committed to keeping us what we call carrier agnostic. Now what that means is we have literally thousands of clients, and we have over 6 million people on the site, and we have no limitations whatsoever in regards to which carriers we can connect with. So if that's a concern, it doesn't need to be. But yes, we are fully owned by Aetna.
Okay, thank you. And you did answer the reason I asked the question, because people would wonder, well, you know, is United Healthcare going to play nice with B-Swift if B-Swift is owned by Aetna?
And you know what, look, I have one more thing to add to that. We also have a pre-selected, call it a menu of different type of ancillary and medical carriers that have agreed to kind of build out a certain number of plans with us that make it easy to implement. I would say maybe about 6 months ago, well after the acquisition, United Healthcare agreed to build a number of plans on our sites and become a fully invested partner in the process. So again, it's not an issue from Aetna's perspective, and as far as we're seeing, it doesn't appear to be an issue from any of the other carriers.
Thank you.
Sure. Great questions. I am right on the 2:30. Well, go ahead.
I was going to say, good questions, Mike. I was just going to say it is 2:30 right now. So if you guys, again, have additional questions, email them to me. I'll get them over to Tony. I'm going to make sure that you guys get all of your questions answered. So thank you, Tony. We appreciate your time.
Thank you. Right back at you, and everybody have a fantastic week. Bye now.
You too. Thanks. All right. Up next, Alan has joined us. Alan Bergman is from Maestro. He's the vice president of Maestro. Alan, are you able to hear me? And I am going to give you access here.
I am able to hear you. Thank you very much.
He should.
It looks like I need to download a quick extension to get that in, which it didn't tell me that ahead, so it may take just a moment.
That's okay.
And share my screen.
So again, Alan is from Maestro. He's going to go through the high-level details of Maestro, and at the end we'll ask from 5 to 10 minutes of questions. So thank you, Alan, for joining us, and you have the floor.
Great. First of all, I want to make sure that we do have the screen set up here because I'm still getting my screen here. Do you have a big screen that says working for your benefits?
Yeah, if you just want to, there you go.
How's that? Better? Now it says
That
we are an
looks good.
employee health and benefits company. All right, great. Well, what I want to do, I know we're limited on time today, and typically to go through a full Ben admin orientation, normally that's a 45 minutes to an hour. So I'm going to do my best to stay very high level. And I did get just the very end tail of the B-Swift conversation. So some of those questions certainly we can go through at the end. But I want to take you through just a touch on who Maestro is and where we're at in the marketplace. I want to take you over and show you at least the dashboard and the beginning of our enrollment platform from the employee experience so that you see a bit of that. And certainly if we want to dig deeper into that, we can spend more time there. And then I want to come out of that and show you the human resources side and the broker side of the platform as far as that dashboard as well. So I'm going to try to stick to about 5 minutes or a little over at each one of those sessions, and we'll kind of pause briefly after each one for some quick questions and then wrap it all up at the end. Does that sound like a fair plan? All right. So everyone has their sort of circle about their company, and no different here with Maestro Health. I just want to cover kind of our core competencies and really explain some of the things that we think are a little different with our platform. And if we start up here at the left-hand corner with the Benefits Admin 2.0, what Maestro has done is about 3 years ago entered into the exchange building business, and we've done that for a bunch of carriers out there, the Blue Cross and Blue Shields of the universe, as well as some of the large public and private sector companies, and built exchanges for them for enrollment. And when you see the enrollment platform, you'll see it's a lot like an Amazon shopping experience, very modernized, kind of a new look and feel compared to most of the enrollment platforms out there. We have had an opportunity to partner recently with Aflac as sort of a new approach to this enrollment or exchange, and that is that Maestro is now the system of record for that voluntary carrier, and that's sort of the road we're going. And what we mean by that is that not only does enrollment take place on our platform, but day-to-day life events and changes in management happen virtually in real time as well. And then all of those changes come through our system that update the carriers directly through EDI for not only coverage but eligibility, and then the same over to payroll and the employer. So in our best example, Benefits 2.0, you would receive one bill or one coverage file from Maestro. You would pay that bill. Maestro would pay all the carriers reconcile all the bills, and then retro that billing and coverage information out to all the carriers and suppliers through EDI. So it does simplify things quite a bit, at least for your clients and the groups. And on Maestro's side, what it does for us is it makes us the one system of record, which I always tell folks, if we were to ask right now with all the bodies in the room, tell me exactly what time it is, everyone with a watch has their own source of truth. And that's what happens a lot in benefits. If we have payroll and the carrier and the employee and everyone has a different source of truth, they all may be correct in their time frame, but when put together, it causes some big confusion when it comes to billing and administration. And that's really what this system does, is it brings all that together in one spot. Looking quickly around the circle, we own and operate all of these pieces independently inside our company. We do have a benefits account, so we do all our own CDH accounts, FSA, HSA, HRA administration. We have our own self-funded third-party administrator, wholly owned, and a very unique approach in that we have over 50 nurses on staff to help with our medical management and claims management there. We do have a department that is run by our in-house compliance officer and their team that does all of our ACA reporting services, including 1094, 1095, variable hour tracking, all the things related to ACA and where that's at up to the moment. Full external billing and administration can be purchased separately. And then also a sort of a bolt-on, we call it people management. So everything from gathering forms prior to hiring, sending out offer letters and things like that in the pre-hire, all the way through the post-termination and full COBRA administration. So we like to think of this as an all-in platform that can handle not only the one day of enrollment, but we call it the shop, enroll, and live. So your employees have access to this platform 365 days a year, as does the administration and the HR. So that's just a little bit about the company. And again, I'll pause there just for a moment and field any questions regarding that, and then we'll jump into the employee side of the platform. Any questions at all? Ollie, are you still there?
I am here.
Okay.
Any questions?
All right.
I don't have any questions if you want to keep going.
Okay. I'm going to go into the employee side of the platform here. And again, very high level. We're going to start, this is just the sign-on screen, pretty generic. You can see there is a spot for us to scan it with the employer's logo, and then a unique sign-in name and password for each employee. This can be emailed, sent out to the employees ahead of time by mail, by communication, drop-off, or we can also make a generic sign-on with a generic password, and at the time the employee signs in for the first time, they're prompted to create their own individual password. So I will jump into to this screen, and when we enter, the screen that you see now is actually the dashboard for the employee that they would see during the year. I'm going to reset it in just a moment to show you open enrollment. I did it this way intentionally because I don't think we want to spend the time to go through the entire enrollment process for open enrollment, but I wanted you to see the dashboard look and feel what this employee would have during the year. So we do still have an open enrollment period open, and we'll look at that in just a moment. But this is an employee who successfully enrolled in their plans for the year, and this would be the screen they would have throughout the year. So if they want to come back and look at their medical choice or look at their dental choice, view their options, put in a request for a life event change, any of those things, again, this portal or this portion is what they would see when they sign on during the year. This platform is interactive so that we'll rescale and stack for any device. So this can be enrolled, self-enrolled by the employee on a PC. It can be on an iPad or even an iPhone. And also assisted enrollments can be done the same way. So we have a full enroll on behalf of feature. So if you're using Aflac consultants or HR consultants or an enrollment firm, the enroller is able to sit with the employee. That enroller information is gathered by the password and the sign-on that come in, and they're able to go through and enroll employees, and we'll see how that works on the employer side. So I'm going to refresh this demo just to show you the screen that a new employee would see when they first sign on to the platform. Maybe. So this is the same data, but this is now an employee refreshed. So if we were first coming in with a group and we didn't have any historical data on that employee and they were to sign on to the screen, you would see a screen similar to this, again with the logo, and then their open enrollment event stated here. A couple kind of unique things that give Maestro platform just a little different look and feel than most that are out there. This is everything that you see on the screen is driven off the demographic data from the employee. So I'm currently signed in as a young family, and you'll see all the images on the platform relate to that. We call these hero images, and on each one of our screens, you'll see a hero image that relates to the employee. Again, not a big difference, just something a little unique that's out there. That does make that employee feel more at home. Our research shows that if the images are cohesive with their life and their lifestyle and their age and things like that, it just makes them more feel at home in the enrollment experience. And I'll show you a couple other things today that also line up with that. Down in the bottom here is just real estate that you can use either as the agent or the employer. We have a voluntary insurance video embedded here, a life insurance calculator, and then some other products about disability money, healthcare reform, just some information for that employee. So those are link outs that are available here. This real estate's available to use as needed. On the introduction screen, really here, all we have is a big Enroll Now button, as this is a new employee at this point with no history in our software. So if I go ahead and click Enroll Now, again, this is going to be pretty standard from what you've likely seen from most of the other platforms you've looked at. The demographic information from the employee is here. That's been uploaded through a census upload on the employer side of the portal. A couple of quick questions about marriage. Assuming here that it's yes because we have dependents loaded as well, a spouse. And then have they used tobacco in the last 12 months? We're going to go ahead and save and continue here. Takes us to the same screen, same type of thing for dependents. And for the demo here today, we just have a spouse loaded and one child. Want to add additional dependents, it's fairly easy to do. You simply click the dependent type and go ahead and add that dependent and answer the questions to add them into the system. As we go into the actual site, I would call this a template version of an enrollment platform. And what I mean by that, we're not going to run through and do an entire enrollment here because we have a lot of voluntary plans and employer-dependent plans and things like that. We will pause to get some questions about those. But first of all, the reason I say template, everything is laid out the same so that we're able to stand up new products or new coverage very quickly without a build process that most companies talk about with platforms. With this platform, we're able to simply insert this first page is all of the explanation about the platform or about the plan. So on medical here, we have a brief description about the medical plans. We have a video embedded here by the carrier that talks about the plans. We have a uniform summary of coverage link out, a benefits book, a little bit about HSA, kind of everything about the plan. And that's the pattern you're going to see. Again, that hero image, young family images or young person images based on the demographic of the person signing in. And then we also have a rather unique feature. We can switch the entire site to Spanish with a click of the button. Everything is translated over so that it's now same information but in Spanish. And I'm going to click back because my Spanish is not that good, and this will be a really long demo if we stayed there. So, from the description screen, the next screen that you'll see with each product is typically the choices, and a couple things unique to Maestro. These are not required, but these are our decision tools. So obviously, if you only have one medical plan, these aren't required. But if you're trying to set up choices for your employees, we have really three categories. We have a show me the plans option where pretty simple. You click there and it's going to take you right to the plans. Those are for folks that kind of know what they want, they know what they're doing. The second option we call the M score, the Maestro score. And this, we have a set bank of questions, and we have 4 of them here in the demo that an employee can answer quickly to help them decide which plan best fits their risk tolerance, their deductibles, and things like that. So simply, on a health plan, are you willing to pay up front for health services? This person says they prefer a higher deductible but a lower premium. They want a plan where they can save money for future medical expenses. So obviously that's driving towards an HSA type product. And then do you currently have enough in savings to withstand a major medical event? So do you have money to pay that large deductible? Continue on, the 4th question is how important is prescription drug coverage? This person says somewhat important. And we like to limit these questions to 4 or 5. We find most people will answer that many. After that, they seem to get a little frustrated with the full question and answer thing. So we hit results, and we'll see that we have 3 medical plans available for this employee, an HSA PPO, a gold PPO, and then a platinum HMO. And based off their answers, we get an M score, or the highest score of 86. We do find with certain demographics, specifically the millennial population, that about 94% of them will choose the plan with the highest score. So if you are trying to direct folks to a particular health plan, or you want to do the research and figure out where to send them based on their needs, this M score procedure is very, very neat to do that. The next generation up, where I'm at, sort of the baby boomer spot, the most popular question we get there is my doctor part of the network? I don't want to sign up for a health plan unless my doctor is part of that network. So this is a unique product from Maestro where the employee can go in, they can enter their doctor's name, and my doctor is Jill Stevenson. I can put in my zip code, and then approximately how many miles from my zip code, about 15 miles out, I believe. And it'll search all the doctors in that zip code within 20 miles that are spelled close to that way. So I'll get all of the doctors in the area, and I can go ahead and find my Dr. Hill here, Jill Stevenson, and add her to my search. I'm going to add a couple other doctors just to show you how this works. And then we can go back and look at the plans. You'll see at that point what it's done is it's taken that same M score, but now also added in off to the side how many of those doctors actually participate in the network for that particular doctor for that health plan. So again, helping the employee make a good decision. They can compare plans simply by checking the boxes here and say compare plans. It'll spreadsheet plan against plan. They can look at details of any of the plans individually as well. It gives them a real good job of comparison. And this works across all of the programs in the platform. So We can set up decision tools and comparison tools for any product. We're also able to generate and use defined contribution as well as any employer contributions and show those in the platform as well. One other, again, very small thing here, but I do want to point it out. It, again, brings that comfort factor in with the employee, is most platforms or most enrollment systems that you see will list the employee, so we'll say employee plus one or employee plus spouse. With Maestro's platform, again, that data drives your choices here. So you'll notice it doesn't say employee, it says Tammy, that's who I'm signed in as. It doesn't say spouse, it says Sean and child Declan. And if we add that, it's simple, the box turns green and the rates re-rate and everything changes on the coverage file. So pretty simple. I am going to go ahead and choose the HSA PPO option here. What happens then is the next plan that comes up will follow that same pattern, but you'll notice it's the health savings account. Had I chose the PPO, I would have got a FSA or a limited FSA if that was option. It'll walk through that decision tree accordingly and only show employees what is necessary for them to enroll in and what their availability is. So it doesn't go through and make them follow step-by-step things that they don't have options for. It only shows them what they have, and it follows a logical tree based off those decisions. So can be separated, again, you'll see on the employer side, but by location, by class, by a lot of demographic to give as many different options in those benefit plans as you wish. There's a shopping cart up here, just like you would see on Amazon. There's also a live chat and a help button as well that the employee can use. So I can stop there on the employee experience. I'll look for a little feedback here, or if you want to see me run through life insurance or voluntary or anything else, we can skip a little ways further into enrolling. If this is giving enough of a taste of what you need to see on the employee side, that's great. If not, we'll go a little deeper. So looking for a little feedback here.
I think just based off of time that maybe we want to go a little bit deeper and see what some of the employer capabilities are or what you have next on the agenda.
That's what I would think as well, but just want to make sure. All right, so if I go back and I go to the employer side of the portal, same thing. Here you have a unique sign-in, and this unique sign-in, again, is based off what permissions you want this particular person to see signing in. So, you know, a particular location for HR would have one access to a group of employees and benefits. Overall, you know, the headquarters HR may have a full view. And those are all things that are determined up front, but this is all driven by your login and password. When you go to the employer dashboard, you'll see at this point we have an open enrollment going on that we were just in, and just some real quick items as we look at the little circle graph here that we can dig deeper into any one of them, but we can see, you know, how many of the employees have registered, how many haven't started yet, how many are in progress, and then how many have completed their actual enrollment. If you have access as a broker to more than one group, that would be under the drop-down here. Obviously, we just have Super Fresh Market as the one employer, but if you had 15 or 20 groups on the Maestro platform, your one sign-in would give you access to those. We can look at all the different plan years that have been enrolled for this group. We can also look at the different enrollment periods for that group as well, and see all the statistics as we go through. This gives us which or what access we have, and this particular sign-up gives us access to Division 1, location in Iowa, and a particular class of employees. So below that, it shows a roster of all the employees that I have access to, and I can look at their demographics and benefits as an administrator by jumping in there. On the right side of the screen is the spot where we can download the census for new hires, new employees, things, any changes that have been made from payroll or from a new hire spot. We also have right below that a spot for approval of life events. Now this is configurable at the class level, so that is really up to the employer what they need to confirm a life event change. So in this case, this is a birth or an adoption, and this employer said they want to approve those before EDI is updated and sent to carriers and before that process goes through. So if that employer chooses that, it would show up here when they sign on, and they could simply approve those changes, and then they would follow through the system. If the employer says, you know what, if Maestro collects that information, we don't want to check that, or we don't need to check those changes or approve them, as I said, that's configurable as we go through the setup and discovery process. Right below that are standard documents and reports that would be requested. Usually these are census files or payroll files, reports that the employer would normally want in a portal. And below that is our data analytics reporting. And this platform is actually hooked into a very powerful reporting tool called Tableau. And Tableau will actually let us do things like look at how long an employee was on the description page for critical illness. So if we see that no one spends any time there, and we're trying to make that benefit more visible for the employee, we may want to change some things. But you can dig down in that analytics reporting to each click in the software, see how long employees are there, see what their participation rates are, and really dig in and maybe make some changes in marketing or approaches by those custom reports. Below that are simply all your system announcements, and then at the very bottom is all the payment information, again, with their open invoices overall with all the carriers, their retro ads, retro deletes, and everything that is related to billing and invoicing. The top right are two tools that I think are very important. The first one is a communication tool, and this allows HR or whoever is signed in with permissions here to send emails or notices to groups, and they can choose those by different demographics, by life event, their status, their division, their location, or their class. They can also send to everyone on the census, or they can go through and pick and choose individual employees. And then from an agent point or an HR point, the little magnifying glass here allows us a different look at the census, but you'll notice that this has what status they're in for their enrollment. So Bam Abidayo here is registered but hasn't done anything. So if I'm an enroller and a counselor or even HR, and I'm speaking with Bam, and Bam says, well, you know what, I'd like to go ahead and enroll with you. Because I'm signed in as the agent here, I can simply click Bam's name, and you'll see his demographic information comes up to verify that I'm with the right person. This would show what benefits he currently has elected, any life events that are out, any notes that are in the system. But if I wanted to go in and enroll on behalf of BAM, I can simply click the button here, and again, all the information and keystrokes are captured for liability and background information, but it would know that I, as the agent, went through this enrollment with BAM and enrolled in whatever products that BAM was interested in. At any time, if I want to get back to that first dashboard screen, simply click the logo of the company, and we're back looking at all of that information. So that was pretty fast and pretty high level, but we did get about 30 minutes, so I'll open it up for any general questions or just things overall that I might be able to answer here.
Thanks, Alan. Does anyone have any questions, Alan?
Yeah, it's Mike. Can Alan describe how this technology is costed out back to the broker or to the employer?
Sure. We have about 3 separate models. The first model is what we call the Aflac Box 3. And those are the 3 most popular group products that are offered through Aflac. And based on a contract that Maestro has with Aflac, you can offer a hospital plan, a critical illness plan, and an accident plan, and use this system for enrollment, billing, and a leave behind for administration of that whole system Maestro is the agent of record, so everything is done through the platform. There's Aflac Group really only issues the policies and pays the claims. Everything else is handled through Maestro, and that product is available to you as a broker to give to your clients. There's absolutely no cost for that system with Aflac product only. But the second model that's out there is what we call bring your own benefits, and that would still have an Aflac product attached. So an Aflac product is in the enrollment, but that allows the employer to bring their medical, their dental, their vision, any other product that they have that they wish to have incorporated in and as an enrollment piece. And that is done with a priority pricing that has been given to Aflac, and that does have some basis on what you bring in. So if it were a small group that was very complicated, it would be a little more expensive. If it were a large group that only had one health plan and one eligibility group, that would be less expensive. And we can give you a range of pricing based on size and just a couple of quick questions. If you're the broker on the case, you'd easily be able to answer. But we basically divide an implementation up into 3 categories. We call it easy, moderate, and hard. And then based off group size, starting at 100 lives and going all the way up to groups over 10,000. And those PEPMs range in the high $6 for the very small groups, down to less than $4 PEPM for the large groups, and that's all inclusive of that. We can also help you with some carrier negotiations to help offset some of that. If you're not familiar with that, we'd be happy to help you with that. The third model is also specially negotiated through the Aflac Public Sector Group, and this allows us a really unique offering to any public sector group where we have the Aflac products mentioned. They can bring their own set of benefits as well, and it also includes a CDH, FSA, HSA, or HRA administration, and that entire package is brought to those groups with no setup fees, no fees up front at a cost of $3 PEPM. But then Aflac, the division of Aflac that runs public sector, will supplement that back to your employer based off enrollment conditions. So they could give as much as $2 per PEPM, so getting your client cost down to $1 PEPM for a full-blown enrollment system for all their benefits that includes CDH accounts for $1 a head. So very, very affordable, very, very unique, and that cost-sharing piece is determined at discovery or pre-discovery with some questions with you, the broker, or the client about the access and the account overall to find out what they're going to supplement towards that $3 PEPM.
Thank you.
Sure.
Are there any other questions for Alan? Alan, you were our last presenter, so you got to go a couple minutes over.
Great. Well, I appreciate everyone's time today, and certainly Holly has information. If you have others, feel free to touch base, and we'd love to work with you and prove that we deserve the business, and we'll preserve, sort of build a moat around your existing business or build a bridge for new business. We think this direction in platforms is where the industry's heading. So appreciate your time today.
Yes, thank you, Alan. We appreciate it too. Now go enjoy the rest of your vacation. Thank you.
All right, will do. Thank you. Bye-bye.
Bye-bye.
I would say that Alan probably gains bonus points in terms of his ability to do the call while on vacation. That's pretty impressive.
Yeah, he's in Cabo right now. So yeah, he definitely gets a little bit more kudos or credit because he's doing it on vacation. But just to, I guess, wrap up the call, I'm going to turn over to Jason. I know that's a ton of information for everybody, but I appreciate you guys kind of speaking through it. So, Jason, if you want to wrap up the call on next steps or what that looks like.
And I appreciate, I mean, 2 hours of technology is a lot. And I just, I appreciate everybody hanging in there. And some of the questions that were asked, I thought were very, very good questions. I think there's probably a few unanswered questions that you have. If I look at the 4 different vendors that we put on today, we had Everwell, then we went to Employee Navigator, then we went to bSwift, and then we went to Maestro. And I look at each of the different vendors and the capabilities that they bring. All are different in a lot of ways, but there's a lot of similarities as well in what they're providing. And really, the one thing I would throw out to all of you is, so now that we have this information, what do we do with it? And you know, that's where we come into play. If you have a unique situation, or you have a situation in which you saw a capability and you thought of a client that it may be a fit, that might be a next step. If you saw a capability that you believe, wow, I would love to explore this more and really get granular with it, that might be a next step. So it might be a case, it may be a learn more, or take this to members of my team so we can learn more. What type of efficiency might this bring to your agency if you were to put it in place? And that's where I come into play in partnership with Holly. My regional team can serve as an implementation team of both communication as well as helping to provide benefits counselors to communicate benefits on these different platforms and the different capabilities. So I'll close with those comments, and I'll also throw it out before we jump off. Are there any questions that I can help answer or Holly could help answer before we jump off the line?
Oh, thank you both for all of your work and effort putting this together today.
Thanks, Mike. Appreciate that.
Very good. Very, very well done, by the way. I said to Jessica along the way that you guys have done a really good job of allowing your vendors to show their stuff. So thank you again.
Good. Thank you, Mike. Any other questions or comments? I know it's a lot of information in a fire hose fashion, but I want to, if there's things that you have in terms of ideas or questions, please don't hesitate. If this isn't the forum that you want to ask the question, please forward any suggestions. We want to deliver value in each and every experience. We know time is precious and valuable, and we want to make the most of that time together. So if we don't have any other questions, we'll send an email recap back out, and maybe it will open up the dialogue to what the next steps may be. But once again, we appreciate your time today, and everybody have a great day. Happy selling.
Thank you.